So my name is Tangi Perry. My background is in home health and hospice. I've been a nurse for over 15 years. Um, and I also just got my wound ostomy and continence nursing recently. I purchased my franchise with AMIV in November of 2022 and have been doing that since. Having been a home health hospice nurse, me and my co-owner Cassie actually decided to purchase the franchise because we saw a need for healthcare to be brought back into the home of clients. My biggest fear was just that here in Utah, there are several IV locations available. Just where I'm located, there's, a lot here in the town that I live in. However, the one unique part that I felt was worth purchasing and taking on my fear was the fact that we would be mobile and be able to take health care to those in their home that are sick. So when I was looking to do a IV mobile, I was looking into doing it myself. However, in looking, I realized how much work would go into doing that. And then so I started looking at other franchise opportunities, which was well over $100,000. And when I found AMIV, it was a fraction of the cost. And I felt like that was the best way to go. So during the day, I am full-time nurse here for AMIV Spanish Fork, and I do all the daily visits. For nighttime and weekends, we do contract with other nurses in the area who will go out and do those visits on those days. Yeah, honestly, running a franchise has been very freeing. It's nice to be able to go and get out of the corporate world, as many nurses realize. You see a patient for 5 minutes and you've got hours of charting you have to do. And with the IV Mobile, you get to go and meet so many really neat people, and it's a good schedule for yourself as well as for the clients that you see. The type of nurse that I feel like would do well in this business is someone who's a self-starter, self-motivated, somebody who works well on their own, who's a critical thinker. Um, as I stated before, I came from home health and hospice, and you're very autonomous out in the field, and that's what I loved about doing home health and hospice. And this is what I also love about AMIV, the opportunity it gives you to, it is a franchise, however, you get to make it your own. What I most enjoyed about working with my clients is I feel like you leave them better than you found them. And that is one of my mottos as a nurse. You always leave someone better than you found them. And it's neat to know that every time you leave an appointment that you have made someone better, and you can see that instantly. Versus, in other parts of nursing, sometimes you don't always see what you've done to help someone instantaneously. When I first purchased AMIV of Spanish Fork, I did keep my job. I worked for about another 6 months. I recently just quit my full-time job and did this full-time because I saw the advantages of working for myself, as well as when you're more available, you're able to market more and reach more people. The problems that I hope to eliminate with purchasing my franchise was, as a home health and hospice nurse, IVs are not offered in hospice actually to patients, but a lot of times we found that towards the end of life, families would panic and want to take their loved one off hospice and take them to the hospital to get fluids, when in fact that can actually harm them more. And then when they do get the fluids, a lot of times what happens is they get fluid overloaded, and then we can't actually place them back on hospice for 24 hours. So my initial goal in purchasing AMIV was initially to help with the home health hospice industry, with hydrating the elderly as well. We have a lot of patients on home health too that would go weekly for IVs to the hospital. And you walk into an ER you're automatically paying at least $1,000 or more. And we were hopeful in being able to bring healthcare back to the home and help these clients get the needed fluids at a fraction of the price. My work family life has improved significantly as I stated before, I've been in home health hospice for 15 years, and when you work out in the field, you work out in the field and you are never off and you always have your phone with you. And although with AMIB that is the case as an owner, you really do get to pick your hours and times, and you get to hire other talented nurses to fill in on hours where maybe you can't work or you would prefer not to work. My goal is to get healthcare to the patient in their home. I went back a couple years ago to get my nurse practitioner's license, and I went to the college that I had actually graduated from with my nursing. And one of the things that they said to me was, "You're just a hospice nurse." And I said, I don't think you realize what that means and what we do. They suggested that I do my master's in education and then they would let me in the program. And they said, "And what do you want to do once you get your NP?" And I said, "Well, I would love to bring healthcare back to the home because that's where it's going." And they kind of laughed at me about that. But honestly, if you look at healthcare now, that's where it's going, is back to the home. There's many IV bars that you can walk into, but there's so many clients who have autoimmune diseases or are elderly or who are very sick who need care in the home. So our goal is to be able to get care back in the home for those clients and make it affordable for them. My support from corporate has been really good. If we have any questions, they're really great to answer. We're always able to text them. They really try hard to get us anything that we need in a timely manner. They are really great about looking at regulations and making sure that we have the latest news on what is going on in the field, what we need to be doing to be up to par with the regulations. And they're just very friendly, and I consider them my friends. Some of my most exciting experiences with AMIV is I had a client who was very dehydrated. They were an elderly of age, and they were shaking. They couldn't even stand up. Their spouse had to help them to the couch. And we were able to give them an immunity boost. They had been having some intestinal issues and some vomiting. And we gave them an IV. And by the time I left, they were done shaking. They were able to walk steadily. Another exciting experience I had is we had a client who just recently had gone to Goblin Valley, and she's very fair, and she was so sunburned. I mean, it started to blister. And we gave her the inflammation revival IV, and within 20 minutes, her back was not near as red. It was barely red. So that was really exciting to see the results that IV therapy can do.